Good day, I am Maria Ana Katrina Pagal from BSN 111N, and now I am going to perform the subcutaneous and intramuscular medication administration. But first, I am going to perform the subcutaneous medication administration. So, subcutaneous procedure, it is the introduction of small amount of solution by means the syringe and needles into the adipose tissue beneath the skin. In doing so, first I am going to check the doctor's order and compare the medication on hand. And then after that, perform hand hygiene. To avoid from cross-contamination. And then after that, prepare the medication and the equipments needed. First, we need to have an insulin syringe. We need to open just the sterile pack. And then after that, uncup the syringe. And then draw air, just the exact amount prescribed by the doctor's order. And after that, inject the syringe into the vial. Then invert the vial. Then get an exact medication, just the exact amount by the prescribed of the doctor's order. And after that, there is no air bubbles. And then cup it and place on the tray. And then write the drug name and dosage into the medication ticket. And now I am going to check the doctor's order and the patient's chart. Good morning, sir. I am Maria Ana Katrina Pagal, your student nurse today. And may I see your wristband, sir? Please state your name.
Jason Pisimbaw.
Your birth date.
March 11, 2003.
Okay, so today I am going to inject you subcutaneous inject. I have to inject insulin in this part of your abdomen. Insulin helps you to control your blood sugars if you have type 1, 90. Will that be alright? Okay. After that, perform hand hygiene. Since I am already performing hand hygiene, now I am going to observe appropriate infection prevention procedure. Arrange the medication card in a hypodermic tray with the corresponding drug. And after that, determine which site will be used and only expose the potential injection site. And then after that, Inspect the area for any bruising, inflammation, or edema. Best site could be the outer aspect of the upper arm, the abdomen, just below the costal margin to the iliac crest, and the anterior aspect of the upper thigh. And now palpate the site. Sir, are you feel in pain?
No.
Okay. And now after that, make sure you have the right size of the needle, and use the thumb and the forefinger of the hand to grasp the skin folds of the tissue and measure the fold from top to bottom to ensure that the needle is half as long. And after that, place the patient in a comfortable position. Sir, can you relax your abdomen? Okay, and then after that, apply a clean gloves. And after that, use antiseptic swab to clean the site in a circular motion. And now pull the needle cup and hold the syringe between the thumb and the four fingers of dominant hand as if you're holding a dart. Now insert the needle quickly, 45 to 90-degree angle. Pain is minimized when inserting the needle without hesitation. And now release the pinched skin and rest the non-dominant hand on the patient. Move the dominant hand on the end of the plunger. And now slowly inject the medication. In several seconds, retain the grasp on the syringe. Now quickly withdraw and then place a swab and don't massage the area. And then after that, assist the patient into a comfortable position. And then after that, document the procedure. Good day, I am Maria Ana Catalina Pagal from BSN 111N, and now I am going to perform the intramuscular injection return demonstration. Intramuscular injection, it is the introduction of medication deep into the muscle tissue where a large network of blood vessels can absorb it quickly. In preparation for intramuscular, first we need to check the doctor's order. The doctor has ordered 5 mg of morphine sulfate to address the pain of the patient sustained from a recent car accident which has caused severe pain and injury at his right arm. So before we could actually draw the medication into this vial, we first need to do the mathematical calculation of the exact dosage needed. So the doctor ordered for a 5 mg of morphine sulfate. It should be divided with the stock on hand, which is 5 milligram per ml. Okay, so the desired dosage divided by the stock on hand and multiplied by the quantity. So it would be 5 milligram divided by 5 milligram multiplied by 1 milliliters. And the answer is 1 milliliters. So we can now draw the medication into this vial. First, we need to have a syringe. So I have here a syringe with a gauge 23 needle. Now we just need to open the sterile pack. And since my syringe are readily connected to the needle, I have to separate the two first so that I can get the aspirating needle into my syringe. Okay. Now I am going to get the aspirating needle, so we can have to draw the medication. And since we already connect the syringe into the aspirating needle, we need to make sure that it's not loose to avoid injury. And after that, uncup. And then now we can open the medication vial. Now since the vial seal is exposed, it should clean the surface with a cotton that has been soaked into a 70% alcohol. Do this for at least 30 seconds. And now take the syringe and then uncup, then draw air with the amount of the medication needed as specified by the doctor. And then after that, inject the air into the vial. And then invert the vial. And then draw the exact medication needed. It would be 1 ml. And after that, we need to remove the aspirating needle. And replace it with a gauge 23 needle that would be used in the actual administration of the intramuscular. And then after that, place the syringe in a hypodermic tray. And then write the name of the drug and its dosage. And then after that, discard the use aspirating needle to avoid needle injuries. And now check the doctor's order and also the patient's chart. And then, good evening, sir. I am Maria Ana Catrina Pagal, your student nurse today, and may I see your wristband, sir? Please state your name,
Jason Casing Bao.
your birth date.
March 11, 2003.
Okay, sir. So now, your doctor has prescribed you a morphine sulfate to abbreviate your pain. And the best appropriate site is the vastus lateralis and deltoid muscle are possible site for intramuscular injection. And then palpate the muscle area. Sir, can you turn into a side lying position? And that if there is tenderness, and then this site might not be suitable to be an injection site. Inspect for bruising, inflammation, and edema. Then now apply gloves. And for the ventrogluteal injection, place the heel of the hand over the greater trapenter of the patient's hip with the unit almost perpendicular to the femur part of the thumb towards the patient's main point, index finger to the anterior superior iliac spine, and the middle finger back the iliac crest towards the buttocks. And then the injection site is the center of the triangle. And now we need to disinfect the site in a circular pattern, and then hold the syringe. And after that, hold the gauge pad between the third and fourth finger of the non-dominant hand. Then uncup the syringe. And after that, hold the syringe as if you are holding a dart. And now, pull the skin laterally for about 1 to 1.5 inches. And then aspirate the syringe by pulling the plunger with your dominant hand. This is to determine if you hit a blood vessel. If a blood vessel appears, so it means you have hit a blood vessels. And now inject the medication slowly at the rate of 1 ml at 10 seconds and wait 10 seconds to smoothly withdraw the needle. Now place a swab on the site and don't massage the area. And now place the patient in a comfortable position. And then document for the procedure. Okay, sir. We are done. Just please avoid touching or massaging the injection site.